Hello, in this video, I'm going to talk about ways to cope with a breast cancer recurrence. Before I go on, I'd love to invite you to subscribe to our channel. We put out content that I think will be relevant several times a week. So let me just recap what a recurrence is. We have videos on both local and regional recurrence as well as metastatic recurrence. But basically, a recurrence is when the cancer comes back or recurs. In the case of a local or regional recurrence, the cancer comes back in the breast or the neighboring lymph nodes. In the case of a metastatic recurrence, cancer was, for all we knew, gone away and no longer visible or measurable, and now it appears again in other parts of the body, distant parts of the body. Regardless of the type of recurrence that somebody experiences, this can be a frightening and overwhelming time. It feels like you put something behind you and now here it is again, but in a different form. So some of the things that can be helpful that we've learned from our patients are, number one, to get as much information as you can. This is a good time to compile information about the original breast cancer and the original treatment. It's also a good time to learn about your treatment options. A lot of people come into the recurrence experience thinking that there's nothing else that can be done for them, and nothing could be further from the truth. There are things we can do for both body and spirit to help you get through this. Learn about what are the goals of therapy. What are the goals of treatment? Is it to cure you, or is it to maintain your quality of life for as long as possible? It's a good time for you to think about what's important to you. You know, a lot of people in the cancer field think that the most important thing to patients and their families is to kill every cancer cell, when that may not be the case for you. You may value quality of life over quantity of life. And letting your medical team know what is the most important thing to you will help you have those goals met, and will also help you feel a little less out of control. The other things you can do is find people who've been through this, whether it's through a support group or by talking with a social worker in your practice or in your hospital, to be connected with other people going through this. There are a lot of resources for people who've had cancer and who've had cancer come back. You are not alone. So finding support, getting information, communicating about your goals of care, making sure you get your questions answered. A lot of our videos can answer a lot of those questions, but of course, your specific case is really different. And that's another key point, is that all recurrences, just like all cancers and all people, are not the same. So if you know of somebody who's had a recurrence and had a certain outcome or experience, it's very likely that yours will be different in many ways, as well as similar in some key ways. The feelings of fear and uncertainty, what's going to happen, maybe anger. You are not alone in having those feelings. There are a whole host of things you can do to take care of your nervous system. Everything from learning how to slow down your breathing, to movement, to prayer, to writing things out, whether it's poetry or just putting all your thoughts on a page can be helpful. You may find that your family is just as bewildered and scared as you are, and that they may not at this moment be the right people to support you. Make sure they have support while you seek out support on your own, and then at some point see if you can come together around your goals of care, the goals of treatment, what's next, and what you need in this moment. All is not lost. Hope is always present. We are making so much progress in the care of people with breast cancer. And although, of course, you never wanted to go through this, you will get through it, no matter what the outcome, and you're not alone. If you have a question or comment about how you've handled recurrence, drop it below. We try to get back to you within a week or two at the latest. Thank you so much for watching.